All right, welcome Brighton to our Utah Pelvic Health Series, Spotlight series that we're doing. I'm excited to have you on here. I'm going to read your bio for the group here watching, and then we'll jump into all the fun questions I have for you.
Hey, thanks, Betty.
Okay. Brighton Roper is a licensed acupuncturist, brings over 15 years of clinical experience and expertise to Utah family acupuncture and herbs. She treats a wide range of medical conditions, including tension headaches, migraine, sciatica, digestive issues, chronic and autoimmune illnesses, and a variety and various types of pain. Brighton specializes in female infertility, offering compassionate and personalized care to support her patients' health and well-being. From 2015 to 2020, Brighton was an active member of the Junior League of Salt Lake. She is a proud mother of two, a daughter and a son, and has a golden retriever puppy named Topaz, who occasionally joins her at the office. In her free time, she enjoys golfing, hiking, gardening, and exploring the outdoors. She also has a passion for eating seasonally and supporting local and organic food sources. Amazing. Thank you so much for Brighton for being on our Spotlight series. I'm excited to jump in to all the questions that I have for you. We've known each other for a long time, so this is exciting to put you on the spotlight here. So tell me, what made you to decide to be an acupuncturist in the beginning?
I got, I guess, a start with acupuncture at a fairly early age, I feel like, when I was in my late teens. And what prompted me going to acupuncture was that I had gone on a trip with my high school and we went to Costa Rica. And it was kind of an intense trip. While we were there, I did get sick, but while we were there, the group also got attacked by killer bees. I don't know if I've ever told you this story, but
No, like this is news to me.
Um, anyway, when I came back from that trip, which was an amazing life experience, I had all sorts of gastrointestinal problems, which I guess isn't uncommon for traveling out of the country. And I think like most people, because I was young, my mom, I guess, exhausted Western medicine. So I went to get, tests to see if I had parasites or a fungus or what was going on with me. And so long story short, at some point we decided to try something different, which was acupuncture. And I thought it was super effective. I don't think it was the only thing that was effective. I think I had to learn about changing my diet and decreasing inflammation in my body. But I also felt like acupuncture really helped with my anxiety. And that's something I had struggled with, I mean, ever since I was born. I don't know. So it put the idea into my mind. And I grew up in Utah. So I attended Westminster. I did my undergrad there. And after I had finished that, I decided I really do want to apply to acupuncture school. So that's where I went on from there.
Very cool. You started young with that in mind.
Yes,
I love
sorry.
that. Okay, talk to us about what makes you different in your approach to being a provider, to delivering acupuncture. Like, what's different about you than just another acupuncturist?
I would say there are a couple of things that are different at this point. One is I've been doing this for over 15 years now clinically. So I do feel like I have a lot of experience. And I feel like I kind of have a barometer on what works and maybe what doesn't work so well. The other thing I will say is that I went to school in California. My school used to be called Pacific College of Oriental Medicine, and it was renamed. It's called Pacific College of Health Science now. But they had a very extensive herbal program. So Chinese herbs was a huge part of the program. And to that point, getting an acupuncture license in the state of Utah doesn't require that you pass the herbal exam.
Mm.
So I feel like there are acupuncturists in the state who are practicing acupuncture but haven't had the herbal
Yeah,
part, which is, I mean, it's neither here nor there, but I would say that that's what sets me apart is I have a lot of herbal knowledge, and in addition to acupuncture, I'll offer herbal consultations for people who might not be interested in acupuncture at all, but they want to try taking an herbal formula.
very cool. Very cool. Awesome. Anything else you want to add into that? Are you good with that?
Okay, let me look. I did make some notes because, let's see. Yeah. I guess, well, we'll kind of probably jump into this with the next question, but so I guess I would say a large portion of my clientele at this point is female infertility patients. And so I would say that is also what sets me apart. Not that there aren't other fertility acupuncturists in Utah, because there are, but um, I would say that my, I guess my own personal, I guess, um, issues that I went through with fertility kind of set me up for that trajectory. But I also wouldn't say I limit my treatments to fertility patients. I kind of work with all sorts of conditions.
Awesome. Awesome. Yeah, that's a good point. Okay, talk to us about who an ideal fit is and who's your favorite patient treat. Obviously, the fertility ones probably. Um, but walk us through like who's that ideal fit? Who are the people that are swimming towards you, who you love and swim right back at them?
No, that makes sense. I feel like the fertility patients are rewarding because they're looking for an outcome, which is to get pregnant. And if they get that outcome, like, of course, that's rewarding, even though there's part of me that's, as a practitioner, trying to have no attachment to results, right? Um, but I would say I really enjoy working with fertility patients. Um, I would say what's a little bit different about me is that for the new patient visit, I schedule off a pretty large block of time. I schedule 75 to 90 minutes um, because I want to take a thorough look at the patient's medical history and kind of decide what they're trying to get from this. In what areas would they like their life to change? So I feel like we look at case management because, of course, it's subjective, but I want to identify places where maybe they would notice a decrease in like frequency or severity of their symptoms, like if it's pain, right? Or um, sometimes before getting pregnant, there's just markers like the menstrual cycle is regulated, right? Or, just different things that would be, I don't know, again, indications of health or that we're going in the right direction. Um, so yeah, to that point, I sometimes have people who um, don't want to put that much into an initial consultation, and that's fine. There are a lot of different styles of acupuncture. There's community acupuncture, which is kind of a more quick in and out thing, but that's not what I have here. I have two, I guess, standalone treatment rooms. So I see one client face to face.
Very cool. Yeah. Okay. What does the process look like to work with you? Like, do we just show up on your doorstep? Do we call and make an appointment? Do you do a discovery call? Do we just do an initial visit?
Please don't show up on my doorstep. No. I do work by appointment. Uh, I've been in the office Monday, Wednesday, Friday, and every other Saturday. That's been my current schedule. And that might change a little this fall when both of my kids are in school because my son's starting kindergarten. But right now it's Monday, Wednesday, Friday, and every other Saturday. And I actually, I'll say my website is utahfamilyacupuncture.com, and acupuncture just has one C. I actually, last September, I upgraded to what I feel like is a really nice EHR system, and it does scheduling. And so honestly, patients can do everything now, which I love. So if people are interested in scheduling, they really can do everything online and fill out the paperwork online. And I guess at this point, I'm just preferring to go to that because 15 years of old-timey charting, I'm just ready for a change.
Yeah,
Yeah.
that's congratulations. That's a big step. That's a big deal too. Awesome. Okay, what's something that most people don't know that you think that they should know about your services?
Okay, I did make notes on this because I feel like there are a couple important points. But I would say since we've kind of been talking about fertility, I'll use that in an example. So in Chinese medicine with any condition, not just fertility, but it's kind of broken down into different pathomechanisms. So like what could cause like migraine, like what dysfunction is happening in your body, what could cause infertility, what could cause insomnia, right? So not every patient who comes for fertility will get the same treatment. It's not just like, oh, these are the fertility points, here you go. So I guess an example would be that like a woman comes to me and she has a known issue, let's say a fibroid in her uterus. So in Chinese medicine, we would kind of walk back and say, well, what's that pathomechanism? And we would say, well, it's blood stasis in the uterus, it's also phlegm in the uterus. So my approach would be different with that patient with acupuncture and with herbs than, let's say, someone who came to me and their uterus is perfect. There's nothing, there's no obstruction, there's no fibroid. But let's say maybe their endometrium isn't as thick as the doctors would like. Or so I guess we would again go back in the pathomechanism for that patient might be blood deficiency, not blood stasis. So it would be a different herbal formula and different acupuncture points, even though the end result is they
Right.
both get pregnant, right? So, but the approach is going to be different for both cases.
That makes sense. Yeah, that's great. Similar
Um,
to us too, right? It's like, well, you could be peeing your pants for five different reasons. We got to find out why.
right. No, and I think because of um what you do, people kind of have this thing like, oh, it's weak pelvic floor muscles, and it could be tight pelvic floor muscles, right? It could be it could be an imbalance. It could be actually a structural thing. It's not you like, yes,
Yeah.
it might be one thing, but there could be a lot going on. Yeah.
There's a lot of skill into like what you're doing, why you do it, and going to the root cause. And I think that's really important just to find practitioners that are willing and able to just dive in and really go for that piece of it. So thank you for sharing that. Kate, do you have anything special that you want to promote to the audience at all? Do you have any like fun things coming up, events, newsletter you want people to join, or anything fun?
Well, I do have an email newsletter. So I don't know. People could get in contact with me and I could sign them up. My email address is familyacupuncturist@gmail.com. I I felt like what I wanted to promote is facial rejuvenation because that's also something I do. And I don't think every acupuncturist does that.
Yeah, talk about
And
that a little bit. I think that'd be a great topic for here.
I yeah, I was putting a lot of thought into that because I feel like I don't know, in this time, people have a lot of options. People would be like, well, why don't I just go to microneedling? And it's like, well, microneedling's a fine option. I'm not saying don't go to microneedling, but the mechanism with facial acupuncture is similar. So the needles are inserted very superficially in the face versus the body, the needles can be inserted to different depths. But the same idea in the face is that it kind of creates a micro trauma. And so your body wants to stimulate collagen production and elastin to help with anti-aging. I would say the reason why people might want to do this versus like microneedling or Botox or whatever else is out there is because the same time they're here, I will be doing body acupuncture points. So I can look at other things going on or that like might be contributing to their aging and work on it on their body as well.
Very,
So yeah.
I love that.
And I would say we can kind of target different parts of the face too, because some people have fine lines and wrinkles. Some people have dark circles under their eyes. Some people want to work on their neck, maybe not so much their face. So I would say that's another area that I like to work on. And that's
Sure.
usually a little bit different from other acupuncture. It's usually a course of treatments, like 10 treatments.
Mhm.
Um, and I felt like I did want to mention, usually when I see a new patient, I'll recommend that they come in for 4 to 6 treatments and then reassess. But also, it's different for everyone because, like, some people have acute conditions. You know what I mean? They might have a muscle strain or a sprain, and that's going to get better quicker than someone who's had back pain for 20 years or something.
Yep. I know that all too well to my core.
One sec. Okay, never mind. Sorry, someone's at my door, but they can.
Hey, my favorite question to ask everyone is what's the main thing that you want to be known for?
um, I would say the main thing I want to be known for is helping women get pregnant. But I would also say what I would like to be known for is that as a person, I feel like I really do have compassion for everyone who comes in and what they're struggling with and what they want to get, what they're trying to work on and fix in their life. And um, I, yeah, I feel like I have like some sort of meaningful connection and I wish the best for everyone. Yeah.
I can vouch for that.
Thank you.
Yes, you have just this the a wonderful soul of
Well, thank
light. Yes.
you.
Okay. All right. Where can we find you? I know you dropped a couple of nuggets along the way, but website, email, location, social media, all the things like
So my office is in Salt Lake. It's in I guess you could say Central Ninth District. The address is 177 West, 700 South, 84101. And yes, I'll give you my phone number, which is 801-359-4780. But yeah, my website, which is Utah Family Acupuncture, has a booking link. You can find more information there about pricing. Oh, and I feel like I should also say that I'm in network with Cigna. So I do accept Cigna insurance. And even for patients who don't have that, they can usually pay with an HSA or an FSA.
Mhm.
So yeah, those are other options.
Perfect. Well, thank you so much, Brighton, for being on our Spotlight series. It's been a pleasure to hang out with you again. And thank you for all you do in the Utah community here.
Thank you so much, Betty. Thanks for having me.
Welcome.